And thank you very much for your time this morning.
Thank you very much for having me.
Just before we look at this information about who is more likely to suffer long COVID, can you briefly just paint a picture about how debilitating it can be for some people?
Sure. For those people who suffer from persistent symptoms following COVID, there's a small number who have really very debilitating symptoms. The ones we're seeing at the moment that are particularly distressing are patients who have overwhelming fatigue and brain fog. So these are symptoms that prevent people from concentrating, that interfere with memory, make it very difficult for them to engage in their normal work or their normal study. We also see a range of other symptoms which might include things like chest pain or breathing difficulties. For some people, problems with maintaining their blood pressure when they're standing upright. But we do know that there's a whole range of symptoms that can occur for patients with long COVID. Up to 200 symptoms have been documented, in fact. So for some people, this can be very distressing and very debilitating.
Now, this research at the King's College in London reviewed data from 7,000 people in health surveys, as well as 1.1 million from electronic health records. And they found that women are most vulnerable to developing long COVID. Why is that?
Yeah, these are really interesting data that confirm some of the things we've heard in smaller studies before. So it's great to see this in really large studies which confirm these findings. We don't know yet why it is that women and perhaps people who are older and people who have previously suffered from asthma are more likely to have long COVID. Those are active areas of investigation. In some ways, it's a challenging finding because we can't change the fact that we're women or that we're older or that perhaps we might have pre-existing health conditions. But I think these findings do provide some clues that will help us with future research. You know, for instance, the finding that people with obesity or asthma might be more prone to long COVID gives us some clues that things like immune function and inflammatory status might be really important in the way that long COVID develops. And they are really important findings for our research in terms of driving this field forward.
We don't have any official data here on long COVID, but what about in the overseas experiment and data over there? Do we know what percentage of people are going on to have long COVID, and could we extrapolate from that to our population?
I think one of the great things about this study that's come out overnight is that it gives us more certainty about the proportion of people who might have persistent symptoms past 12 weeks. And actually in this study, it's quite low. It's less than 5%. So I think that should provide some reassurance to the population at large that this is something that affects a relatively small number of people following a COVID-19 infection, and that most people should expect to have a good recovery. What it does mean, however, is that we do have this small group of people at the moment we don't have adequate treatments for. We're really providing supportive care. And there's a really urgent need, I think, for research in this group to find better treatments that can address these really significant symptoms.
So that was going to be my next question. You know, do we have appropriate treatments here? And if not, we know that research takes some time. How do we help those people immediately?
Yeah, absolutely. I think two other important findings that have come out recently is that long COVID is less likely in people who are vaccinated. So that's another good reason to be vaccinated. It's also less likely in people who've had Omicron compared to Delta. So that's also encouraging in terms of what we're going to see in the future. As you say, research does take a long time and those specific treatments are still a way off. I would say in the meantime, it's really important for those people who do have persistent symptoms, particularly beyond around 4 weeks, that they do seek medical care and assessment. One of the really critical principles is that we exclude other causes of these symptoms that might be able to be adequately treated now. So that means undergoing a thorough assessment from a medical professional to make sure that there's nothing that we're missing. When other causes have been excluded, what we're providing at the moment is really supportive care. So that might be, for some people, physical rehabilitation for those who have persistent physical disability. For some people, it might be neurocognitive rehabilitation or supportive strategies to help them with things like memory and concentration. For some people, it will be other forms of supportive care, including care from psychologists and care, really critically, from GPs to make sure that the rest of their healthcare is adequately managed. managed. So whilst we don't have the optimal treatments yet, and we're still working towards that, I would encourage people who experience those persistent symptoms to seek medical help.
Just finally and briefly, Anne, despite long COVID at this stage only representing a small cohort, we know that we are yet to learn more about it. How impactful do you think it could be on people, the workforce and the healthcare system?
I think this is a potential area where we'll see significant impact for a relatively small number of patients. And we know that this is a disorder that's affecting people who might be in the prime of their life. They might be studying, they might be working. We are particularly concerned about that group of patients who are struggling to get back to work and back to study. So there's really important implications both for their health and wellbeing and financial wellbeing, but also for society. And I think for the healthcare system at the moment, we are struggling to work out how best to organise care and support these patients. And perhaps we don't yet have the optimal models of care in place for that. And we're likely to see demand continue, I think, for patients with persistent symptoms following COVID for some time.
Professor Anne Holland from the Alfred Hospital, thank you for joining us.
Thank you.